Medical professionals of Reddit, what's the most FK'd up thing you've seen? NSFW NSFL. Not a medical professional, but a volunteer in the Australian says. The guys in orange overalls you see on TV in Australian disasters. Close bracket. Basically we can be called on when the cops need extra arms and legs for something. Many times. This is looking for people who have committed suicide in the middle of nowhere. I was with my partner and we were on foot looking for a 4WD truck in the bush. The guy had left a note and gone out to shoot himself. Just after Christmas. Due to people being away. He had been out there for about a week before someone phoned it in. It had been stinking hot. And we were ordered to find the car but not to approach. Well, we found the car. But as we approached it to take the license plate to confirm. We say that the windows were black. And moving. The guy had shot himself with a heavy caliber rifle. The bullet had pierced the roof. Which let the flies in. We called it in and noped the FCK out of there. I still get nightmares about that truck. Some of the gangs in my area use a punishment known as bagging for dissenters. It involves an LRP with a broken glass bottle or any other unpleasant object. The term bagging comes from the colostomy and ileal conduct they usually end up with from the rectal and lower urinary tract injuries. Pretty grim in 20-year-old guys. People wonder why gang violence is so bad. It's because shit escalates. You might get your ass kicked sometime at the local bar by the opposing gang. But then you decide to go back with some friends. They get their ass kicked and decide to come back with guns. Whoever survives comes back with more guns. Or waits a while to get them alone. It escalates from there to killing families, loved ones, torture, rape, etc. EMT here. I've seen a lot of messed up stuff. But this one was messed up ethically. Not just gross. I got to the scene of a hit or run. Already that is messed up. Then we find out that the first people to get to the scene robbed the patient as he was lying on the ground. So this guy, almost dead, now has no shoes or wallet or anything. I was so disgusted by this. Not the patient himself. I've seen worse injuries and he survived. But by the way the people treated the situation. Very messed up. Does veterinary medicine count? While on my large animal rotation we had a cow come in that hadn't been acting normally. Apparently about a week ago they pulled a calf from her and thought that was the end of it. It wasn't. They hadn't checked and a dead calf remained in her which had been macerating and autolysing in the uterus. When she came to the hospital, we put her on the tilt table and adjusted it so that she was on her back. I clipped her abdomen and as I was scrubbing it, the foulest smelling fluid would squirt out of her vagina. The surgeon exteriorized the uterus, which was enormous. And as he cut into it, a huge wave of fluid, bones, and clumps of hair poured out of it towards us. The smell was so bad it took all I could not to vomit. I then had to run over and collect the bones and hair clumps so they wouldn't get stuck in the machinery and damage it. The entire hospital, which is huge, mind you, stunk afterwards. It was by far the most disgusting experience of my life. My ambulance house covers an area which contains a small airport. My second week as an EMT. We had a call that a skydiver was found in the middle of the woods. We got there an hour later. Mainly because we could only drive so far in. And then we had to carry all the equipment about a mile. We arrive. And the skydiver didn't have a head. It wasn't cut off, but rather broken off. I assume that his neck hit a thick branch on the way down and it just snapped off. I was later yelled at by my lieutenant for not performing CPR. He's not the lieutenant anymore. I hope you looked at him just like this and number 3232. And number 3232. By now I've become accustomed to the sight sound smell of almost anything. So the things that get to me are the emotionally difficult cases. My worst. One of the first few times I was in the ER. There was a large gang related shooting. Among the people to come in was a 7-month pregnant woman who had been standing in the crowd that got sprayed with bullets. She was shot in the back and side of her abdomen. She was bleeding internally on a massive scale. After liters and liters of saline and lots of blood, the decision was made to take the child out, so the OBs rushed down to the ER from upstairs. As they were doing their thing, massive hemorrhage became overwhelming and emergency procedures were initiated. These are brutal. In this case it involved cracking open the thoracic cavity in an attempt to manually beat the heart by hand. A few minutes later she was gone. Later, I found out that the baby was affected by sickle cell and that there was no one else to take custody of the child. So it went to foster care. I rarely cry, but this was one of those times. I was working in the ER on New Year's about 2 years ago. An older man comes stumbling in, complaining of his bum hurting and bleeding. Thinking it was just a hernia, I set him a room and assisted the DR in examining this poor guy. The reason why he was in so much pain was there was a huge summer sausage in his bum. Taking it out tore and scratched his colon, so there was more bleeding than I'd like to have seen. The guy survived, and after 2 weeks he was ready to go home. It's funny reading stories like this and hearing this guy had complained of his bum hurting and bleeding. Like there was some semblance of mystery as to why he would have these symptoms. Called to a liquor store for a male with multiple gunshot wounds. Got escorted in by police and found him laying on the ground. Alert but going into shock. Cool diaphoretic. Confused. Weak pulses. Got out to the unit and cut his clothes off. Found 1 GSW to each wrist. 1 to the leg. 1 in his pelvic area. And 1 had gone directly through his nutsack. By the wounds, it appeared to be a small caliber weapon. All in all, he was lucky he didn't die, I suppose. Turns out, the shooter believed the victim had been messing around with his wife. Found him at work and fired directly at the guy's balls. Have only been in the biz for a few years, so I am sure I will see worse. But seeing a guy get his balls blown to shreds will forever stay with me. It appeared to be a small caliber weapon. Man, don't kick the dude while he's down. I work at a VA hospital. On the surgical floor. I think one of the sickest things I've ever seen was an old man who had gangrene of the leg so bad that his tibia was exposed down near his ankle. Whenever he moved his foot when we were changing the dressing, which was all too frequently, the tendons made this horrible squishy sound. I've also seen gangrene of the scrot. Terrible shitty. I'm a volunteer firefighter EMT. A few years ago we got a call where someone in an apartment building called in a foul odor coming from their neighbor's room. The police had removed the lock and entered for a wellness check after learning that the resident hadn't been seen in quite some time. Inside was the body. A woman, about 75 YO. Halfway melted into her reclining chair facing out of a large window with a nice view. It was the middle of summer and there was plenty of sun coming in. So for the last few weeks her skin had been baked to a crisp. And most of her rotted interior had leaked from just about every opening you can imagine. And completely soaked the chair, carpet, clothing, etc. Imagine the worst smell you've ever experienced. Mix it with dog tea and horseradish. Multiply by 10. We had gas masks on and guys were throwing up. Here's the kicker. There was a small dog in the apartment that survived for an estimated 3 weeks by eating the woman's legs. Do I win? Medicine resident here. As a med student, I was working on trauma surgery and a guy comes in with a gunshot wound to his buttock. Came in through the side. Pretty bloody wound, but it looked pretty superficial. So after cleaning it up, we decide to use a vac dressing to help it heal. Vacs are sponges covered in plastic which you put over the wound. Then hook up to suction to help the healing. It only works with a good seal. We spend forever sealing up the sponge. Then turn on the suction. But it doesn't work. All we hear was this weird whistling noise. We start checking the seal and the tubing, trying to find the leak. Finally, one of my colleagues says, "Guys, I figured it out." He sticks his finger in the patient's asshole. And the whistling stops. The bullet must have nicked the rectum. Which we hadn't seen until then. Guy ended up with a much bigger surgery. TL. Doctor, I had a patient with a whistling ass. I'm not in the medical field, but a friend of mine is an EMT. He's a tough dude. But one night he told me about the aftermath of an accident he'd helped with. A man who had been drinking hit a 20-year-old girl with his minivan, pinning her to a tree. He walked away unscathed. It took her 10 minutes to die. He won't talk about it anymore. Story from my mom. While she was working in the ER, she had a man come in with his chest split in two. He had been messing around with a chainsaw and it kicked back into his chest. It got infected and became too swollen to close. So she had to clean out and change the bandages while they waited for the swelling to go down. Along the same lines, but not medically oriented, my father is an old school hard ass. Hard drinking. Hard hitting. Strong as a bull type. Think Clint Eastwood. A year or so before I was born, he was out back chainsawing a tree when the tree broke and the chainsaw slipped off and gored his thigh. My father wasted no time and instead of going to the hospital he asked my mother for a sewing needle, hydrogen peroxide, whiskey, and thread. Taking a few shots to numb the pain, he disinfected the wound and needle, then proceeded to sew himself back up. Afterwards, he went back out and finished chopping up the tree. I later learned he missed his femoral artery by inches, and had that happened, I would most likely not be here. I work in a cardiovascular ICU. We had a patient who was there for 40 something days. Had every complication you can have with heart surgery. The one that finally got him was when his sternal wound popped back open from a particularly hard coughing fit. He also had developed Stevens-Johnson syndrome, which probably weakened his tissues inside his chest. His sternum had been slowly pulling through his sternal wires. I could see all the way down to his pericardium. It was horribly infected, so there was soupy pus everywhere. Needless to say, he didn't make it. Was a terrible shame. He was such a nice guy. I don't know what any of those words mean, nor do I want to know. I used to be a veterinary technician working for an emergency clinic. We had a breeder come in with her very ill and pregnant Boston Terrier. The dog was in severe dystocia, meaning she was trying, but could not give birth. The doctor palpated her and could tell there were 4 alive and very ready to come out puppies. One even sucked on her finger. However, the puppies were positioned in such a way that would have made natural birth impossible, so the dog needed a C-section. We informed the owner of this, along with providing an estimate for the surgery. She broke down the math out loud, figuring out how much money she would make off the puppies if they all survived, and determined it wasn't worth it for the surgery since she wouldn't make a profit. Then, she promptly told us to just put the mother down because she'll just get a new one and start over. She was willing to essentially kill 5 animals because it wasn't profitable enough for her. Don't worry. We had her surrender the dog, mother and puppies made it out okay. Not a medical professional anymore, for career reasons and perhaps a little bit stress related, but honestly, the most f-ked up thing isn't gore. You get used to gore. You even get used to gore involving innocent people, children, etc. It takes a while, but you do. The most f-ked up thing you'll see is cumulative. It's humanity. It's 14-year-old suicides and 43-year-old addicts living, literally, in their own soil in the gutter. It's spousal abuse, child abuse, RP victims, especially RP victims you know personally. It's the never-ending parade of human suffering. Trauma isn't the hard part. Humanity is. My uncle is a surgeon. He once told me that a gay couple once came in. This couple was having sex and decided to insert a light bulb in the other's asshole. The light bulb exploded because the asshole had too much pressure on it. He said he had to remove over 200 shards of glass from this dude's ass. That's f-ked. Working ER when a gunshot wound victim came in. He tried to shoot himself with a shotgun but put the barrel to the bottom of his chin flush with his skin. Well, the recoil and blowback of the shotgun threw his head back when he pulled the trigger, resulting in his face being blown in two. His brain was completely not affected. But his face looked like a predator or something. His eyes were almost 10 inches away from each other, just half dangling around. On good authority. Old doctor teaching med school stopped in class one day and chuckled. Then told this story. Back in the day we used alcohol to clean patients' bodies before surgery. So we had this guy all prepped up and ready to go. Naked on the operating table. When out of nowhere someone had a tiny little spark of static electricity. The guy's entire body was instantly on fire. We all just stood there. Stunned. For a second. Until one of the nurses or doctors turned around. Grabbed a sheet. Threw it over him and the flames went out as quick as they started. We all looked at each other. Made sure the patient was okay. And then we all agreed that we will never speak of this ever again. Asterisk. The patient was already sedated. We couldn't find any actual complications caused by the fire. And we went ahead with the surgery. The surgery was successful. The patient recovered normally and never knew a thing. He did have a very slight, hardly noticeable tan. To clarify, this event happened over 40 years ago. My friend is an EMT. Here's his worst, most puke-inducing story. There was a guy who had a colostomy bag. Apparently he was missing a big chunk of his digestive tract. Intestines wise. I'm not medically trained so I don't know how that works. But whatever. Anywho. This guy's bag had backed up. And can you guess what he was puking up? Yep. Shitty. Pure. Runny. Stinky shitty. Vomiting it. Out his mouth. The thought of having runny shitty flowing out my mouth is just too much. Not me but my mom. She's a nurse at a veterans hospital so she deals with a lot of guys who went off the deep end after wars. Anyway she said this homeless guy came in and he smelled like piss and shitty. Apparently the guy had been just laying on the streets for years and didn't even get up to go to the bathroom. He just put towels down by his dick so he could pee in them and never changed. Back to what my mom saw. She said this guy had the nastiest infection down his legs and on in his penis. She said his dick was literally green and had pussing blisters on it as well as his legs. The guy couldn't pee. I think this is why he came in, and my mom had to shove something up there to clear his dick out and allow him to pee. This is the worst thing I can think about that she has told me off the top of my head. Not a doctor. But I was getting my shoulder checked out when I was 12 after dislocating it. They were asking me on a scale of 1-10 how bad it hurt. I had never had any injury so I wanted to say about a 7. Well, right before I said that a girl about my age was wheeled by me screaming and crying holding her knee. I could see every bone in her knee. I immediately looked at the nurse and said 1. It hurt like a 1. I worked in burns and literally the last patient that I had there was a 12-day-old infant. Badly burned. Seems the family all up and left when the house was on fire leaving the baby for the firemen to rescue. By the time they got him he was burned over most of his body and had an inhalation injury. I had to take care of him because I was most experienced with peds. He was so young that they put in umbilical lines. We kept him alive during the first 24H which is called the resuscitation in burns but after about a week or so they realized that he was so badly burned that if they took off all that needed to come off he would only be a torso. Incredibly they considered this for a while but luckily for the infant the more experienced surgeon talked them into putting him on comfort care only because it was unlikely that he would have survived anyway and with the family present and crying he died shortly after support was removed. After being there 10 years this case just gutted me and I had to stop working there. Be working in ER my intern year 100-120 hours week. Lady comes in after trying to deliver at home for 16 hours. Breech birth. Baby got stuck in her. Halfway out, head was stuck inside her, its body and legs just limply dangling there purple colored. Baby was dead, for at least 10 hours, cold. I guess by then she had waited enough. Upvote if you would let back a night shop 254 number 1785 SXU good. Middle-aged homeless lady found down and brought in by ambulance. Sick as tea. Febrile and hypertensive. Totally confused. Classic septic shock case. We were initially unable to figure out the source. A nurse putting in a Foley catheter noticed something unusual coming out of her vagina. Pelvic exam revealed a rotting small black bird. Patient is admitted to the ICU and has a complicated 3-week stay. Once stabilized is questioned about the bird. She's crazy-ish. TN tells us that she found the bird on the ground. She thought it was cold and figured she'd try and warm it up. So she took the next logical step.